Welcome back to Unleashed at Work and Home. I'm Colleen Pilar, and I'm joined today by Dr. Laurie Schulze, who is a veterinarian who specializes in behavior work in Ohio. So I wanted to talk to her today about listening and understanding what someone else is saying to us because, of course, our animals don't speak to us with words, but they're communicating all the time. And with humans, sometimes our language gets in the way. So we want to talk a little bit about listening today. Welcome, Laurie. Can you tell us a little bit about what got you interested in behavior work with animals?
Honestly, when I was little, I was always fascinated with dolphins and thinking I wanted to be a dolphin trainer, but when you're 5, those kind of, so I think I've always been interested in behavior. Then as I got into veterinary medicine, working through my career, I had a situation, I just started seeing people were having problems with their pets with behavior concerns, were just as much at risk for losing their home or relinquishment. So, and their relationship, if the dog was stressed at the office, I was trying to figure out what ways, we could do to help them. So I just kind of got drawn, and behavior when I was going through veterinary school, wasn't as, it's kind of grown. I've kind of grown with it. So we didn't have classes on behavior. I had one elective my senior year. So a lot of my education I got through professionally, but outside, veterinary conferences. And the more I learned, the more I realized, especially on one of the topics we're going to talk today, is things I didn't know about basic body language because I wasn't taught.
Right. That
once I learned, my eyes just opened up to, oh my gosh, these animals are, they're not mad or they're not angry at me. They're not trying to hurt me personally. They're terrified or they're afraid. So it just totally changed my perception. And also I started seeing, oh my gosh, if I didn't know this, my owners don't know this either. And finding that I want to help, protect the bond between people, because if there's a behavior problem, they're just as much at risk for losing their home or dying from the behavior problem through euthanasia, just as if they had parvo or cancer or, and so you wanted to figure out ways to make, as a veterinarian, practice better so that my patients, when I worked with them, they were as comfortable as they could be in that situation. And then also helping my owners and their pets have a better relationship, as well as realizing there's anxieties, that there's all kinds of things that, that training, that they have a medical pathology with their anxiety to help those pets that have that as well.
Yeah.
Sorry, that was kind of a long.
No, that's absolutely it. And one of the things that you said in there really resonated with me because it was the experience I had too, which was when I was taught some of this information about body language and behavior, it really opened my eyes. And because I was taught, that some of it's not intuitive, and yet once your eyes are opened, you can't unsee. Like once you start recognizing and understanding the meaning of things, you have a whole different view of the world, and it changes your perspective on so many things, which then changes the stories we tell about it. The dogs aren't spiteful and angry and manipulative. Oh, they're frightened and anxious and, like all of these pieces, but we don't do a great job of teaching that information as a culture. Dogs are happy and easygoing. Everyone knows that. Not always. So that idea of really understanding what your animal is communicating to you requires some attention and active listening, not so much with your ears, but whole body listening, all attention onto what is trying to be said in this situation. So can you tell me about a situation in which you had a client whose dog was very clearly to you saying one thing and that the owner really couldn't see it until you kind of helped open their eyes?
Yeah, a lot. I mean, this is pretty common, but one client I had a new pet that they had adopted. And they were very, they wanted to, and it was a small pet. And so it was easy to, physically manipulate, or go after, So they thought, and the dog, so this is what's interesting. The dog does like to be near them. The dog just really doesn't like to be touched.
Right.
If that makes sense.
That makes total
sense. He's not
sense.
a dog, a lot of touching. So even, and there was a couple times that the dog had snapped at them. One time broke skin, one time did not, because I think because the dog had bitten, the owner was a little more like, ooh, maybe I need to be a little more cautious. But they would reach over, and the dog is like, he's low to the ground. His eyes are as wide as they can be. He's turning away. He's under a table. And the person is still approaching. Mm-hmm. And I'm saying, ooh, I think, and so I started intervening, and I'm, because I didn't want the person to be hurt, obviously, when I was in the appointment. But even when I was there talking to them about body language, they still, at the beginning, couldn't see it.
Right.
But after we were done, then they were kind of like, oh, okay. And they started changing. Like, I'm like, okay, don't reach over. Wait till he comes to you. Reach under. If he's under something, he's saying no, thank you. And even talking to them, like when I was tossing him treats, he would take food from me, but I never touched him. Mm-hmm. Because, and I explained to them, he's okay with being near me, but he's still not okay with me touching him.
Right.
So after a little while, I was going to try, because he did start approaching me and he was eating freely, and we were going to try to see if I could do a physical exam. But I'm in their home. He had seen his primary care veterinarian, so it wasn't, and I can look visually and see a lot of things, but I wanted to listen to his heart. There was no, and I was talking them through, okay, he's leaning away, his eyes, he stopped eating. This isn't worth doing this, because I knew he had bit in the past, and of course I don't want to be bit. And I'm like, see, he's not comfortable. And this isn't an emergency. We don't need to finish this part of the appointment. We can work on that later, because he has some issues with going to the primary care veterinarian. But then we talked about things we could use, medication and stuff to help that. But it was when I first was there. But the good news was I'm sitting there thinking, okay, this dog has bitten them or had 2 bites, because I still count, even if they don't break skin. To me, if teeth go on skin, that's a bite.
I agree.
Because I think people dance around. Mm-hmm. So that means that could happen. So I thought, oh my gosh, this dog, he didn't bite. Obviously, he did not bite during the appointment. But he was showing signs. I'm like, oh, this dog shows so much that they can avoid this. They had to really have pushed him. And they did, not that they were doing, they just, with their physical space and invading their space, when it happened, was they were trying to put on his collar, and they went right towards his face.
Right.
And that's the time, and he was under something, and they went after him. So we talked about, different approaches for that. But there was a case where if I wouldn't have been able to educate them about that, they would have gotten in more trouble, because they would have continued to not see it. But the good news was, this dog, not all dogs, but this dog was very clear to me what he didn't want, and he was very tolerant of them. And when I was talking to them, with other people, and he, then now when people come to visit, it's a much better situation, because they have rules. This is when this dog is telling you he wants attention, or he wants you to physically touch him, and this is when he doesn't. Mm-hmm. And the problem with him is he's very cute and small, and he's cool, and I don't want to say his name, but he has his name, it's a dog that it's hard for someone not to go pick up. And I think that I think a lot of small dogs get in that trouble, and they're like, oh, dogs love me. And then they come up to him, and then he's not happy, because they're frightening him with how they're doing things. Plus, the way we approach dogs in general, everyone comes at them straight on and puts their hand right out. And if I walked straight up to you and grabbed your face, and I'd never met you before, even knowing you, you'd be like, what are you doing, Laurie?
Yeah.
But people I didn't know those things either before. So I would have done the same stuff, because culturally, that's what you do when you greet a dog, or at least that's what we're taught. So that was a case where and then I had another case where I did the same thing. It was a young puppy, and by showing them, because I take, showing them the body language, the pictures, and I send videos, helping them see, this puppy was very fearful, and they were also approaching the dog, and they weren't expecting the children. Like, the dog was under the table, the kids were right in its face, and then that's when a bite happened. Fortunately, it wasn't something that caused any injury, but it was very clear that this dog wasn't okay with his body language. And then after teaching them, they changed how they were approaching, and the dog is, the puppy was saved in his, he's in his home. Their last report is things are doing great. I mean, there was an astute veterinarian that he was working with that, saw and heard some issues at the first puppy exam, and then recommended that they come see someone to help, a veterinarian that works with behavior to help them, to make sure, just to look at the situation. And it was simple things that, that they didn't realize, that being able to tell them and watch and see in their environment how they interacted and looked at the place and look at the home, I could see, okay, well, here's the spot where he goes. So, you make a kid-free zone. Or so I was talking to someone, we started calling Julie Smith an alone zone. Mm-hmm. Instead of, sometimes if you say kid-free, that might sound kind of not so nice to the kid. But if you're like, this puppy's in his alone zone right now, so we're going to give him when he's there, that's alone zone. He's saying, I want to be alone. Right. And they can still want to be with you, but not want to be restrained or touched. Anyway, sorry, I went off on a tangent.
No, it's all behavior, and that's what we talk about here. So let's turn it now to people. So from the idea of that we want to interact with others in the way they want to be interacted with, and the concept of, one thing that's very interesting to me about body language and behavior is that it's all driven by the limbic system. So how we're feeling inside affects how we present ourselves outside. And so we're not thinking, I feel afraid, so I will make myself smaller and turn away. But when we do, we do. So those pieces drive it. So at work, from the perspective of really understanding each other, what are some of your tips for really being able to do this between people?
I'm better with animals.
Aren't we all?
So tips. I guess I try. I don't, I'm not as good with people, even though you kind of sort of have to be to do it. I do it. I've learned, to kind of try to pay attention to what I'm seeing with the person. If I say a word or I say something and I see their body stiffen, or if they cross their arms, I try to watch. So I go, ooh, okay, I've gone somewhere that I need to be aware of. And then, I stop. So I try to pay attention to when I'm talking about something, the body language of the person, and look at what they're doing. Or sometimes if I feel like there's something, to try to say things like, well, after I give a recommendation, or I'll say, how does that make you feel? Or are you okay with that? Or would you be willing? So that there is an opportunity for them to express whatever they're feeling and listen to what they have to say. So I guess my tips would be, try to be aware of what people, when you're talking to them, their body language, looking for them stiffening up, or if I start to see, and I don't even know how to explain this, but if I start to see I'm going down an emotional thing, like I really listen for things if they start going onto something personal, which will happen when I go into home consult, then I try to be very aware of this, like, because sometimes, I have to talk about hard things,
right? Especially
when you're talking about aggression cases. Do I talk about, is this person going to shut down if, is this might not be the point to talk about. Maybe I'll never bring up that dog leaves the home in that moment, because I'm listening for them. For example, I mean, and there was, or even like medication. I was with a client and we were talking about medication to manage the situation if the behavioral medication doesn't work, because it can help us. And how do you feel about that? And she quickly was like, oh, that's wrong. And I wouldn't do that to my child. Like, so I listened to what she was saying and went, okay, that's off the table. That doesn't mean I wouldn't have ever brought it up later. But at that moment, that was not a time to talk to her about that, because she's thinking, I wouldn't medicate my child. How dare you bring up medication about my dog? Mm-hmm. If I would have kept trying to be like, oh, but medicine is, that's the only thing that we can do. Or like at that moment, she would have shut down. She would have heard, even if I gave her all my best arguments for why this would be, she would not have heard it in that moment. If that makes sense.
That makes total sense. It's a tricky spot, isn't it? That balancing act, because you want to be able to continue the conversation. And when people feel like we're refuting them and bumping up against them, they're not listening anymore. So it is challenging, I think, because it's always balancing as you go along. Is this a good time? Is this not a good time? Where can we go with this? And people have so much going on inside their heads. We don't know what all the contexts are. So when she's saying, I would never use a medication, I would never use it even for my child, but, definitely not going to be doing this. There's a whole family history behind her of other experiences that we don't know. We don't know what happened that makes her feel so passionately about this for a tool that has worked very well for many, many, many dogs. And possibly hers in the future.
Yeah. And the other thing that I have also learned is to try to tell people, I really try, as far as when listening, to show, I truly, when I talk to my clients or even anyone, I'm like, I want to know what's going on so there's no judgment. Mm-hmm. But I'm very conscious when I'm listening that I don't reflect, that I want them to feel comfortable in sharing everything, because if they feel like they're going to be judged and not listen, like I want to present, I'm here to listen to you without judgment, because I want them to be able to tell me everything, because it gives me a perspective from where they're coming from. And it helps me help them and their pet. If I don't know what was happening really when the dog did the thing they didn't like, and they're doing things I'm not aware of, it's not that I'm going to judge them, but I can say, okay, instead of doing this when he does that, we can do B, but there's no judgment. So I would say, another tip for people is when you're having difficult conversations, to really try to, even if someone says something that pulls emotion in you, to try very hard not to react to it. Like, oh my God, I can't believe that happened. Or
that's the worst idea. We can't do that.
Right. Well, even just taking that's something I'd really try to work on, because sometimes people say things you're like, I didn't expect that, but it's just to try to stay calm. I don't know if that helps with listening, but I really try to help.
I think it does.
People know that they can freely tell me, whatever's going on. I know life. I am a mom with 3 kids. I try to do my best every day, with positive reinforcement, even with them. But I know, I get that sometimes you lose your temper. We're human. No one's perfect.
Right.
So I want my clients to know that, I need to know and want to know everything that's going on and answer honestly, and know I'm not, you're not going to be judged, because I get it, and it'll help me help you and your pet.
Have you read Risa Van Fleet's The Human Half of Dog Training?
I have not, but I need to.
It's all of the things you just said, so maybe you don't need to. It's very interesting because it's about tackling conversations in ways that don't make the other person feel defensive, and opening things up so that we can all move toward the shared goal of making situations better. And I think that there's a lot of stuff that can be really helpful for people at work in work conversations, because again, a question like, why didn't you do the blood draw is more likely to make somebody crazy than why it seems like a lot's going on today.
What
you
happened?
know, what things can I help with? You know, where's things going wrong? And it's an interesting challenge for us to be aware of how we affect other people with some of the questions we ask and the body language we use when we're asking them. And we want people to feel open to tell us everything that's going on.
Right. And I also have found that through learning, I don't know if your listeners will, but the more I learned about canine body language and communication, the more I'm like, it doesn't matter if you're a dog or a cat or a horse or a pig. We all can benefit from these concepts.
Yes.
So it's maybe I'm even getting more interested in the human side of communication and want to learn more there so that I can be a better consultant and coach or, you know, for my clients, because I need to help them and we need to be a team. And if I am not able to communicate with them or you know, it's not going to work. They're not going to follow up. And, you know, it also helps yourself. You know, behavior is hard work because a lot of times we're dealing with some hard stuff. You know, and there are some things I can't control, but I just want to know that I've done my best job to help them because, like you said, there's a whole backstory that I may not know, and it may not have anything to do with me. It's just where they are in their life and all the other things that are going on, and this is something they just can't do. But I do think, you know, if more people look at their pets and learn about, you know, canine feline communication, they can also, I'm not saying you go around and train your husband or your children, but it's still the same thing.
Oh, absolutely. That's why I do what I do now. I mean, I started as a dog trainer, and then I started realizing, if I want to change this dog's behavior, I need to change these humans' behavior.
Right.
Oh, I better learn how to deal with people. So it was really interesting that it's become this completely obvious progression when I look back on it. But at the time, all of the pieces were a little bit of a surprise. I need to learn how to have conversations more tactfully. I need to learn how to identify what the underlying issues are that they're not saying. I need to recognize that there is an issue that they're not saying. And so it's all these fascinating behavior pieces, because I'm a behavior nerd.
Yeah, and listening, and another thing that'll be interesting to me is if I have a couple, you know, if there's a couple in the household, and listening, and that's why it's important that sometimes you can tell two people are on two opposite pages, and that's really hard. That's not a very good sign for me in helping the dog if the people are on two different things. Right. But it's important to know that, because then you're like, okay.
It's very important.
I have a bigger challenge. And I would think even in the work environment, if you got two people on two opposite pages, you've got to say, okay, what common ground? What's a deal breaker for you? What's a deal breaker for you? What is our common goal? And figure out a way to move towards the common goal, whatever that might be.
Yes.
So I think that would be another tip, is if you're in a situation at work where, you know, you have a problem going on between people, to try to figure out, okay, what do we all agree on? We all want, I don't know, the appointments to go more efficient. Okay, what are your ideas? You know, and help focus on a common goal instead of, well, she does this or he does that.
Yes.
You know, and, you know, I think, okay, those two people probably will feel better if they feel heard. Like if they really get a chance to feel heard and let them say what they need to say.
Yes.
And then it might be easier to find that compromise or that common goal. And they're like, okay, maybe, you know, I can do this better and she can do that better. And we all end up with, you know, appointments move faster, but everyone gets taken care of. Or maybe, as you know, I'm not in a clinic right now. I mean, I've been in the past where I have multiple people, you know, but then as the supervisor or the boss, maybe if you don't listen to both people and help work to the common goal, you might not be aware, oh, gee, I'm expecting her to do 10 things. She can't possibly do that. So we need to help her here. It's not that what we do to our dogs, not Susie's bad or lazy. She just needs to work faster. if you don't sit there and ask and hear from Susie, you don't know what to do to help everyone go to the common goal.
Yes.
Which would be maybe, okay, we get through appointments faster, but everything still gets done. You know, and that still helps because clients don't want to, or the dog doesn't want to sit there all day.
Right.
Either. So it helps everybody.
It does help everybody. And really giving people the chance to say everything that's on their mind before we leap in with the, well, here's what we really need to do kind of thing. Because we're prone to giving advice before we've actually heard people out.
Yes.
And it's usually better to not even give the advice, but to get the people to come up with the advice on their own, to ask questions that lead them to come up with a suggestion or a solution that would work for them. And then they have ownership of it. And we're like, yeah, that's great. And what about maybe this little piece added on top? What do you think?
Yep. And that's something I'm, you know, trying to do more of too. Even, you know, help. I don't want to be, to help people, like you said. I mean, and you even think about with their animals, control, like to feel like you have control of something is reinforcing and makes a person feel better. You know, so if someone thinks, ooh, I solved this problem on my own versus I had to have someone tell me what to do.
Yes.
That you're going to get, and you're always going to have better feeling, I would think, between the person that was getting the advice if they feel like they're asking for it versus being told you need to do this or you need to do that.
Right. Yeah, it's an interesting piece of how having a sense of control really affects happiness levels. And we see that in animals all the time.
Yes, and that goes to, but we don't think, giving them a choice in the matter helps a lot.
And it plays out big at work, too. Like, if you feel like, here are the things that need to get done, but I can choose how they get done or when they get done or what the order is, or, then people feel better about it rather than when they're feeling like someone telling me all the time.
And it's hard, but it's hard to do. Like, as a mom, I have a daughter that's getting ready. My first to go to college. And it's very hard to not be like, you have to do this, you have to do that, you have to do this. And I'm trying really hard to be more like, for example, there's something she needs to do this before a date. And I'm like, well, why don't you put it in your calendar to remind you? Because I know, because for her and for all of us, if a date is far away, it's like, I got plenty of time to do it. So then I brought it up again. She's like, okay, I'm going to do it this weekend. So then I walked in there and I was like, okay, are you ready to write? Are you ready to do what you're supposed to do? And I told you I would do it, I'll do it Sunday. And I had to stop and go, okay. And I just went, you know what? You got this. I was just giving you a friendly reminder. Cause I know I'm not gonna be able to do that soon, but it's still the point of, she does need to take ownership. She does need to learn how to manage. So I'm trying to think, okay, I'll step back and be more of a coach and say, here's a suggestion. This is what helps me when I have to manage. I showed her my calendar of all of their stuff and my stuff. And I'm like, this is what I use because I couldn't do this without my calendar. I couldn't know. And I'm like, and you're right now, you're going to start having papers and things you're going to do. And I'm like, I have my lunch written down. I have things I'm doing socially. So that if someone asks me to do something, and if I see 20 different colored dots on my Google Calendar, I'm like, next week. But, but I can't make her. But so I'm trying to do the same thing with them and trying, hopefully I'll be able to do that with the clients. And even with our pet, animals, as we're doing with cooperative care, like teaching them a skill. There's a lot of it with the chin rest or, or holding their paw or whatever, so that if they can't do it in the moment, then that what you're asking is too much in the exam. So like if you train your dog to put his chin on your lap as the vet's doing the exam and he goes to do something or she goes to do something and the dog removes it, that doesn't mean that's the dog telling you, okay, something about that is too much. It's not the dog being bad. Right. So, but I think that helps dogs have a choice, because if they're like, okay, that's too much, then as the veterinarian, you could be like, okay, can I change something about what I'm doing? Can we add a different food? Can I do something? Or is it time for chemical restraint, which there's not, meaning, I got to do something that this dog can't tolerate. So I'm not going to put 4 people to hold him down while I force him through it. Then you're like, okay, he's telling me this is too much. We've tried X, Y, and Z. Okay. Owners, what do you think about, some chemical restraints so we can get this final thing done? And he won't be the wiser. Quick injection, sleep you go, get it done, wake up, and you go home. But I do think giving animals choices and exams would be helpful too for them.
Yeah, we all like choices. I mean, it matters so much of whether or not we feel like we have any control in a situation. That hugely affects happiness levels and cooperation levels. So this has been a really interesting discussion of really being in tune with those that we're interacting with. And it's not always easy because we have a million thoughts going on in our heads too. So we're saying and thinking and doing things that they have no idea about, and the same is happening in reverse. And we're all trying to meet in the middle and have a shared understanding of what actually occurred. Not always as easy as we'd think. Okay, so one of the questions I really love to ask is a perspective question. Again, you have a Lab Golden mix named Wessler. How would Wessler describe you if he could use words?
If he could use words, oh geez, how would he describe me? I think he would describe me as an intermittent treat dispenser, busy, I don't know. How would he describe me? Fun. I hope he would describe me as fun. Sometimes, I would say I would be loyal, concerned about others. Expects a lot. Expects a lot. Forgiving. And I hope he would think I would be fun. And I bring in toys.
It sounds like a great description for a coworker in most cases. Someone who's busy, loyal, concerned about others, expects a lot, and is forgiving and fun. I mean, I would like to work with people like that, because it is a matter of balancing, expectations. We're going to get good stuff done, but we're going to have fun doing it. And it should be well done. So I think he's described a very nice coworker for the world. And if we could all just try to be as good as Wessler thinks you are, that would be good for us. So could you tell our listeners how they could reach you and learn more about your business?
Okay. They can go to my website, which is www.protectthebond.com. They could also search me on Facebook. It's Laurie Schulze, Schulze, and then the comment DVM. And they can go there and find ways to message or, a phone number if they're in the Columbus area, if they're interested in a consult. Or if they have a question, concern, that's
and
where
I
they
apologize.
can go.
I just realized I mispronounced your last name. I said Schulze as opposed to Schulze.
It happens all the time.
I'm sure it does. But I try not to do it. I should have.
That's okay.
My apologies. So thanks so much for joining us today. I really appreciate that.
Thanks for having me. It was fun.
So anyone listening, if you thought this was a useful conversation that could help you at work, could you please share this with any of your friends who are animal care professionals? Just passing the word around about behavior and how we can all be better at work can really change the world.